What happens if you ejaculate every day? As a urologist, I've heard this question countless times. In today's information-saturated world, it's hard to know what's actually true. Is it a sign of a healthy libido? Or could it be too much of a good thing? Is daily ejaculation good for your health? Does it affect your fertility or your prostate? Today, I'll give you straight answers from a medical perspective. There's no simple yes or no answer because the reality is much more nuanced, especially for men over 40. Your ejaculation frequency is actually an early indicator that reflects your overall health status. Coming up, I'll share 7 proven benefits and 6 important concerns to be aware of, all based on actual scientific evidence. By the end of this video, you'll have a much clearer understanding of how this very personal habit can affect your physical health, mental well-being, and sexual life. Most importantly, you'll know when you need to see a doctor. Let's start with the positives. What are the potential benefits of ejaculating every day? First, it triggers the production of pleasure hormones. From a urological standpoint, one of the most significant benefits of ejaculation is the neurochemical response it triggers. When you ejaculate, your brain releases what we call a neurochemical cocktail of beneficial compounds. This includes endorphins, which are your body's natural painkillers, and mood elevators, essentially your internal morphine system. You also experience a surge of dopamine, the neurotransmitter associated with pleasure and reward pathways. Then there's oxytocin, often called the bonding hormone, which promotes relaxation and reduces cortisol levels. Finally, serotonin helps regulate mood and contributes to overall psychological well-being. This hormonal cascade is why patients often report feeling relaxed, content, and mentally clearer after sexual activity. From a clinical perspective, regular release of these hormones can contribute to better stress management and improved mood regulation, both crucial for long-term health. The second benefit is improved sleep. If you've ever felt drowsy after ejaculating, there's solid science behind this. The release of prolactin during orgasm induces feelings of relaxation and sleepiness. This is why many of my patients report easier sleep onset after sexual activity or masturbation. The same beneficial hormones we just discussed, oxytocin and endorphins, also help reduce stress hormones like cortisol, promoting what we call parasympathetic nervous system activation. This is your body's rest and digest mode, which is essential for recovery and healing. For patients struggling with insomnia or stress-related sleep disorders, this natural sedative effect can be therapeutically beneficial, leading to better sleep quality and, consequently, more energy and better immune function during the day. The third benefit I want to discuss is cardiovascular health. During sexual arousal and orgasm, we observe significant physiological changes. Heart rate increases, blood pressure rises temporarily in a healthy way, and blood flow improves throughout the entire circulatory system. This process promotes vasodilation, the widening of blood vessels, which is beneficial for your cardiovascular system. Think of it as interval training for your circulatory system. The improved blood circulation ensures that oxygen and nutrients are efficiently delivered to all organs and tissues. Recent studies from Harvard involving over 30,000 men have shown correlations between regular sexual activity and reduced cardiovascular risk factors. Over the long term, this can contribute to better heart health and may help maintain healthy blood pressure levels. Think of it as a mini workout for your circulatory system. The fourth benefit is one of the most talked about, the decreased risk of prostate cancer. This is perhaps the most researched and significant benefit from a urological perspective. Multiple major studies have explored the relationship between ejaculation frequency and prostate cancer risk, and the results are compelling. The most notable research comes from Harvard University, where researchers followed over 30,000 men for nearly 2 decades. The results, published in European Urology, found that men who ejaculated 21 or more times per month had a 31% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times per month. The protective effect was strongest for ejaculation frequency in young adulthood, even though prostate cancer wasn't diagnosed until decades later. Men who averaged 4.6 to 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before age 70. The leading medical theory is that frequent ejaculation helps flush out the prostate gland, clearing it of potentially harmful substances and old cellular debris that might otherwise accumulate in prostatic fluid. It represents some of the strongest evidence we have for a modifiable lifestyle factor that can influence prostate cancer risk. The fifth benefit is an improvement in your immune system. You might not think of ejaculation as a way to fight off a cold, but some research suggests it can help. Studies have shown that sexual arousal and orgasm can increase the levels of certain antibodies like immunoglobulin A or IgA. IgA is one of your body's first lines of defense against viruses and bacteria. Furthermore, the stress-reducing effects of orgasm also play a crucial role here. Chronic stress is known to suppress the immune system, making you more vulnerable to illness. By helping to lower stress levels, regular ejaculation can indirectly support a stronger and more responsive immune system, helping you stay healthier overall. The sixth benefit, it's actually good for your pelvic floor health. What many people don't realize is that ejaculation involves significant pelvic floor muscle contractions. These are the same muscles that support bladder and bowel control. Regular, rhythmic contractions during orgasm can help maintain muscle tone in this region. For older men particularly, maintaining pelvic floor strength is crucial for preventing urinary incontinence and maintaining sexual function as we age. It's essentially exercise for some of your most important core muscles. Finally, the seventh benefit involves natural pain relief. There's evidence that orgasm can provide natural pain relief through the release of endorphins and the temporary blocking of pain signals in the spinal cord. Some of my patients with chronic pain conditions report temporary relief following sexual activity. This is likely due to what we call the analgesic effect of orgasm, where the neurochemical changes temporarily raise your pain threshold. While this isn't a treatment for chronic pain, it can be a helpful complementary approach for some individuals. Now, as with any medical topic, we need to address the other side of the equation. While daily ejaculation can offer benefits, do you know what the downsides of ejaculating every day might be? The first potential issue is that it can become a psychological compulsion. From a psychiatric standpoint, it's crucial to distinguish between a healthy habit and compulsive sexual behavior. If you enjoy ejaculating daily and it doesn't negatively impact your life, then it's likely not a problem. However, if you feel an overwhelming urge to do it every day and it starts to interfere with your work, social life, or responsibilities, it might be becoming a compulsion. Compulsive behavior is characterized by a loss of control where the act is no longer a choice, but a perceived necessity. At this point, you should consider speaking with a healthcare professional. Signs to watch for include spending excessive time thinking about or engaging in sexual activity, feeling unable to reduce the frequency despite wanting to, or consistently using sexual activity to escape stress or negative emotions. Second, it can be used as an emotional crutch. Many people turn to masturbation and ejaculation to cope with feelings of stress, anxiety, fear, or sadness. The release of pleasure hormones provides temporary relief, making it an effective short-term coping mechanism. However, there's a medical concern when this becomes your primary coping strategy. Using ejaculation as an emotional crutch can prevent you from developing other more sustainable coping strategies like exercise, meditation, or talking to a friend or therapist. It can mask underlying psychological issues without actually addressing their root causes, which can be detrimental to your long-term emotional health. The third potential problem relates to fertility. Daily ejaculation will decrease the quantity of sperm in your semen. Your body needs time to produce and mature sperm. While production is constant, a full recharge can take around 72 hours. However, when you ejaculate daily, your body doesn't have enough time to replenish its sperm reserves to maximum levels. This results in a lower sperm count per ejaculation. For most men, this isn't a problem, but if you and your partner are actively trying to conceive, ejaculating every day might reduce your chances of success. In this specific scenario, spacing out ejaculations by 2 to 3 days can help ensure a higher concentration of sperm, increasing the likelihood of fertilization. For most men, daily ejaculation won't cause fertility problems. But if you and your partner are actively trying to conceive and haven't been successful, you should discuss ejaculation frequency with a reproductive endocrinologist. The optimal frequency often depends on your individual sperm parameters. Fourth is the concern about potential desensitization and decreased sexual desire. While it may seem counterintuitive, ejaculating too frequently can sometimes lead to lower libido. This is partly due to the brain becoming accustomed to the constant release of pleasure hormones. If your dopamine and pleasure systems are constantly being activated, they can become less responsive over time. You need more stimulation to achieve the same level of satisfaction, and your natural sexual desire may decrease. Sometimes taking occasional breaks from daily ejaculation can help reset your system and reignite that sexual spark. The fifth issue we need to discuss is sexual performance. This is particularly relevant if your daily ejaculation occurs through rapid masturbation. If you consistently focus on reaching orgasm as quickly as possible, you may inadvertently be conditioning your body for premature ejaculation during partnered sex. From a sexual medicine standpoint, this creates what we call maladaptive learning. Your nervous system becomes trained for speed rather than control, which can translate into difficulties with ejaculatory control during intimate relationships. Additionally, performance anxiety can develop if you begin worrying about lasting longer with a partner. This psychological pressure can actually contribute to erectile dysfunction, creating a cycle where anxiety about performance makes it more difficult to achieve and maintain erections. Finally, from a purely physical standpoint, daily ejaculation through masturbation can sometimes lead to minor injuries or irritation. Overly vigorous or frequent stimulation can cause skin irritation, small tears, or even nerve sensitivity issues. If you're experiencing any pain, persistent soreness, changes in sensation, or visible irritation, it's important to reduce frequency and consider speaking with a urologist. These issues are usually minor and resolve with rest, but they shouldn't be ignored. Additionally, if you're using lubricants or aids, make sure they're appropriate for frequent use and aren't causing allergic reactions or skin sensitivity. As a urologist, I want to emphasize when you should consider seeking professional medical advice. Seek immediate medical attention if you experience persistent pain during or after ejaculation, blood in semen or urine, sudden changes in ejaculation volume or consistency, inability to ejaculate when desired, erections lasting more than 4 hours. Consider consulting a healthcare provider if you experience significant anxiety or distress about ejaculation frequency, relationship problems related to sexual behavior, decreased sexual satisfaction despite frequent activity, using ejaculation primarily to cope with negative emotions, difficulty reducing frequency when you want to. For men over 40, any sudden changes in sexual function should be evaluated. Consider discussing ejaculation patterns during routine checkups. If you're trying to conceive and haven't been successful after the 6th of December months, remember, these conversations with healthcare providers are completely confidential and more common than you might think. We're trained to discuss these topics professionally and without judgment. For men in their 20s and 30s, daily ejaculation is generally well tolerated and may offer the most pronounced benefits for stress management and immune function. This is also when the prostate cancer prevention benefits seem to be most established, based on the Harvard research. For men in their 40s and 50s, this is when ejaculation frequency often naturally decreases due to hormonal changes. Don't worry if you notice this shift, it's normal. However, maintaining regular sexual activity, whether solo or partnered, can still offer cardiovascular and stress management benefits. Pay attention to any sudden changes in sexual function, as these can sometimes be early indicators of cardiovascular issues or hormonal imbalances. For men over 60, quality becomes more important than frequency. Focus on maintaining sexual function and pleasure rather than achieving any particular number. Regular ejaculation can still offer benefits, but listen to your body and don't feel pressured to maintain youthful frequencies. If you experience significant changes in sexual function, discuss these with your doctor, as they may indicate underlying health conditions that can be treated. Remember, gentlemen, sexual health is health. There's nothing shameful about these topics, and maintaining good sexual function is an important part of aging successfully and maintaining quality of life. Take care of yourselves, and don't hesitate to seek professional guidance when you need it. Your health, including your sexual health, is worth prioritizing.